on the Zero Hour. I'm your host, Richard RJ Eskow. I've known my next guest for many years now. I'll say on a personal level, it makes me very happy to see her looking so well, because it was seemingly not so long ago, actually years ago, that she was battling cancer and fighting for health insurance policy in this country that would allow her to treat that cancer. So that is, of course, an ongoing battle to make sure that everyone in this country has the health care, not just the insurance, but the health care they need to survive. And here to talk about it with us now is my friend Laura Packard. Laura, among other distinctions, is the executive director of Healthcare Voter, and she's going to bring to our attention an issue that I think is very important in the coming weeks. So first of all, Laura, welcome back to the program.
Thanks for having me.
Secondly, well, something's on your mind. What is it?
Well, this is going to be a critical election for healthcare. Everybody says that every time around, but this year we'll see what happens in the House and Senate, and particularly when it comes to abortion. We know what's on the line, and that the Supreme Court overturned Roe versus Wade. Women no longer have a guaranteed right to the reproductive health care that they need. We've already seen people suffering because of it. And so we can't fix that unless we have majorities in the House and the Senate and a president that's willing to sign legislation. So that's one piece. Another piece is the Inflation Reduction Act that just went through has a lot of great things in it, including lowering the cost of prescription drugs for people on Medicare. But as a part of that fight, there was a battle to cap insulin copays at $35 for everybody, regardless of whether you have insurance through Medicare or not. And Republicans in the Senate forced a ruling to throw that out. So we had a chance to cap insulin at $35 for people with private insurance or no insurance at all. And Republicans killed it. So that's another piece that we could fix if we have the votes next year. Also, there are 12 states that have not expanded Medicaid, which means low-income people are priced out of health insurance in states like Georgia and Florida and North Carolina and Texas. And their state, their governors and their state legislatures show no signs of moving on this. So that's 4 million Americans that should have healthcare right now that don't. And that's something that we could solve federally if we had the votes in the House and Senate. So it is critical on so many different levels for our healthcare that we vote for healthcare champions in November.
You know, this is the point in the conversation, Laura, where and one of those historical points where, and I'll deal with this elsewhere in essays and monologues, but where people are going to tell me, which they don't have to because I do health policy, the limitations of the Affordable Care Act, the limitations of allowing private insurance into Medicare, all of which, believe me, I know by heart. And I've invested a lot of energy and time to pushing for Medicare for all and all sorts of things that we don't have. But this is where I think your story, and if you don't mind my story, are kind of instructive, okay? For example, let's take one provision of the Inflation Reduction Act. And I hope you don't mind me just taking a second to be personal about it. But this is why I get passionate not only about the ideal healthcare system, but about doing everything we can in the meantime. I have 2 life-threatening chronic conditions that are well managed, but well managed at the cost of $10,000 to $12,000 a year out of pocket for medication under Medicare, because despite my youthful good looks, I am on Medicare. So the fact, for example, that the IRA will, if nothing happens to it, limit out-of-pocket expenditures for Medicare drug recipients like myself, drug coverage recipients like myself, to $2,000 will save me, if nothing goes worse, $10,000 a year. But it's also being delayed for 2 years, which will cost me $20,000 if nothing goes worse, in which case it will cost me more. So I get it that, on the one hand, there's the world we want, which I will never stop fighting for. On the other hand, there are the things we need and can get right now. And this is where it's my problem to deal with the comment section. But I do think it's important to say that what you are doing and what people like, advocates like you are doing, is very important toward, first of all, making sure that my $2,000, to put it in personal terms, is protected, because a Republican majority could take it all away, to make sure that we could maybe do more if we had a bigger majority. So I just wanted to inject that as a note of perspective, because, I don't want to, what was Biden's line, don't compare me to the almighty, compare me to the alternative. I don't want to go there. But on the other hand, we do need to protect the marginal gains we've gotten and to build on them, right?
Absolutely.
Oh, sorry for the diversion, but I just thought it was important as context for my particular audience to understand why we're talking about this.
Absolutely. And, if we were starting the American healthcare system from scratch and we had the votes, obviously we do much better universal coverage rather than all the different systems we have today that sort of work together and sort of don't. But we live in this world, and it is the year 2022. And in 2017, I was diagnosed with stage 4 cancer, and I had the Affordable Care Act. And so my costs were limited to my out-of-pocket maximum, which was high. It was thousands of dollars, but it cost hundreds of thousands of dollars to save my life. And that's money that most of us don't have, will never have. And so it's not a perfect system. We can do better. We're working on doing better, but in the system we have, these programs save lives, and we're making incremental progress.
And I think that's exactly right. And it's interesting, of all things, on Twitter, I saw that Larry Levitt of the Kaiser Family Foundation, Kaiser, does great research on this stuff, was posting a chart and pointing out that 2.5% of the citizens, of the people in Massachusetts, are uninsured. 18% of the people in Texas are uninsured. And while 2.5% is too high, everybody should have insurance, we can agree on that. A lot of the remaining 97.5% should have better coverage than they do. We can agree on that. But that's a huge difference. And to me, as we explore the reasons why, I think one of the reasons, correct me if I'm wrong, but I think Texas is one of those. The Affordable Care Act offered aid to states to expand their Medicaid rolls, and to get more people on, which is desperately needed. And yet 22 Republican-controlled states or thereabouts refused to go along with it. Is that right? Am I right so far?
Yeah, and many of the states have come around, but there's still 12 states that have held out. And those states include big ones like Florida, Georgia, Texas, and North Carolina. And so that's 4 million Americans that should have healthcare right now that don't because of their state's choices. And it's a lot of low-income people. It's a lot of people of color, younger people, people that work, shift jobs where they don't have healthcare. And the way the Affordable Care Act was originally designed was it was designed to cover people who made a certain amount of money, and the people that were below that would get Medicaid. So the plan was for every state to expand Medicaid to cover people up to a certain level of income. And the Supreme Court, again, the villains in this piece, they voted to make it optional instead of required. And so there's this gap that states that refuse to expand Medicaid, there's this gap of people that do not qualify for Affordable Care Act plans because they make too little money, but they don't qualify for Medicaid either because Medicaid wasn't expanded. And so these are low income, hard hardworking people that are just stuck in this gap that because they make too much and too little and they can't get help.
And Medicare, by the way, excuse me, I keep flipping them. I got to stop being so self-obsessed. Medicaid, by the way, is really a great program. I mean, I just want to put in my 2 cents on that. I've worked in my past life as an administrator on a Medicaid program. I know what it does for people. I know it's good coverage. It's coverage that brings care to people who, without the kind of out-of-pocket barriers that might keep them from getting treated at all. And of course, if there's no coverage, then what choice do they have in many cases, but to die or suffer? So when we talk about Medicaid, to me, there's no moral ambiguity of any kind. We're talking about getting good coverage to people who desperately need it, right?
Yes. And the thing is, in these states, the government pays most of the cost. The federal government pays most of the cost. And the rest of the costs are made up just by funding the hospitals and so on, that all this uncompensated care that happens right now because they don't have insurance. You see rural hospitals closing and so on. So this is something that would actually save these states money, but they won't do it.
Yeah, it's astonishing. And I think that's a really important point because what you see happening, for example, the last time, one of the few times I've been in an emergency room was about 3 years ago. And the guy in the stall next to me was a guy with no coverage from Washington, D.C., where I was being treated. And he was up front. He was wheezing. This was the only way he could get his asthma medication. Inhaler that you can get a script for. The only way you could get a script for and then be handed an inhaler was to go into the emergency room. Now, if that's the case in a place like Washington, D.C., how much worse must that be in a place like Texas or Florida, where people have no choice but to go to the emergency room, racking up high costs. So what are we dealing with here? I feel as if what we're dealing with in terms of these Republican governors is, because let's be real, they're all Republican, right? So what we're dealing with is what? Hatred of poor people, hatred of government programs, because it's not saving the money in many cases, as you just pointed out. What are we up against exactly?
I think it's all of that. It's stigma against poor and working class people, against government aid of any kind, against Obama. They labeled it Obamacare as a way to stigmatize it. And so they are cutting off their noses to spite their faces that, these states have seen a wave of rural hospitals closing because the financials don't make sense. Texans are dying because of lack of healthcare that Texas could accept at any time, and yet they refuse to do it. And this is politicians sloganeering instead of delivering the meaning behind their words. A pro-life culture would have expanded Medicaid a long time ago to save lives.
Right, absolutely true. So as we talk about, the upcoming election, let's specifically talk about the upcoming election. What would it take, for example, to get Medicaid to 4 million more people?
Well, in some of those states, like I mentioned, the big ones are Texas, Florida, North Carolina, Georgia, also Wisconsin. Those are swing states. And so if you live in one of those states, pay attention to what your state legislators support or not. Do they support expanding Medicaid? Do they support expanding healthcare? And if they don't, vote them out, because it's just a handful of votes in all those 4 states that determines healthcare for millions of people.
And I'm trying to think of how many of those states, for example, have senatorial races this year. Florida, Texas, Wisconsin,
Georgia,
of course.
North Carolina.
North Carolina, right? So we're really talking about, well, for all of us, of course, but for those 5 states, if 3 of those states voted out the Republican that they have now, we could conceivably do something dramatic about Medicaid and other healthcare things too. Is that a fair statement, you think?
Yeah, well, I don't think Texas has a Senate race, but the other ones do. And the stopping
governor,
point,
right, in Texas. Is it governor? Yeah.
Yes. Okay. So the stopping point is the state legislatures and the governors in those states, and all of those states are toss-ups for their governors. And also the Senate is another place where we could make a fix. They talked about fixing it back when the bill was Build Back Better, before it was the the Inflation Reduction Act.
Right.
But they didn't quite have the votes for that. So yeah, a couple more people that are willing to amend the filibuster, to work on another bill to expand healthcare, and we get there. So we can get there through the Senate. We could get through the state legislatures and through the governors. In some states, the governor can do it unilaterally. In some states, you need the state legislature to go along. And also there have been ballot initiatives. And in every state, I believe every state that there's been a ballot initiative to expand healthcare, the people have voted for it. And so places like Nebraska have expanded Medicaid because this is a common sense bipartisan thing that specific politicians have stigmatized, but they are not answering to the people here. They're answering to Fox News.
And remind me, I mean, I know it may not be precisely relevant to the election, but I know Kentucky, for example, Mitch McConnell's state, Kentucky Care is extremely popular, or certainly was at the time of his last election. I don't know if they had a referendum to expand it or not, but Kentucky to me is an ideal example of a place where the people have elected a senator, the lead senator, in obstructing something that they personally support a great deal. Is that a fair statement, you think?
Yeah. And if you look at Kentucky versus Tennessee, that are 2 very similar states right next door to each other, Kentucky expanded Medicaid and Tennessee did not. And you just see with a number of people that have healthcare, with just the robustness of their healthcare systems, it's been extremely valuable for Kentucky, but Tennessee has not had the leadership to do something on this. So you see people like Mitch McConnell and Rand Paul that rail against the Affordable Care Act and programs that are directly helping their people. And I think that for too long, many folks have let these politicians slide by because they say they're pro-life, but nobody ever asks them, well, why don't you support healthcare? Then why don't you stop saying bumper sticker slogans about fetuses and start supporting babies? Because all of these politicians are against paid family medical leave. They're against health care for growing young families. They're against universal pre-K and fully funding public schools. And they literally stop caring as soon as the fetus is born.
No, absolutely. You know, Nancy Pelosi had a good line the other day when she said that some of her Republican colleagues think that life begins at the candlelight dinner the night before. And yet, what she didn't add to it, as far as I know, is but right to life ends at the moment of birth if you're poor or black or brown or what have you. And you're absolutely right. There's an enormous hypocrisy there. But, you know, and this may be a slight diversion, but I do wonder why they get away with, how they get away with it. If just the other talk about vague, cliches about this or that, just why nobody ever pins them down. I mean, obviously, Democrats do, progressives do, and so on, but why the majorities who vote them in never call them out on it. Do you have any theories?
Well, I think that the gutting of media is part of it, that local papers have disappeared. Anybody to hold these folks accountable for their anti-life votes. So I think there's some of that. Also, polarization in this country means that people follow politics like sports teams as opposed to like the people that are making decisions that affect their daily life. But I think it's on all of us to, before you vote and while you vote, to dig deeper and make sure that they aren't just saying platitudes, but they're actually delivering. And this is not exclusive to Republicans. There are Democrats that have done votes for big pharma and so on. So, I mean, I think it's on all of us, especially during primaries, which is when on a lot of these gerrymandered districts, who represents you is decided in that primary. But don't just accept bumper sticker slogans, but get them to deliver results backing up their slogan. If they say they support life, where are the votes to expand healthcare?
Right, absolutely. So you are director of a group called Healthcare Voter, which I assume encourages people to vote on healthcare issues. But I will admit I know very little about that organization. So why don't you tell us?
Sure. Well, Healthcare Voter was formed in, I think it was 2017, 2018. And we have co-chairs, including folks like Alyssa Milano and T-Boz Watkins of TLC. And our goal is to educate voters about healthcare, about their representatives and how they vote, and get people to turn out and vote about healthcare, because this is a healthcare election. Whether you can access reproductive healthcare in your state depends on what happens in November. This is your chance. If you don't like the way things are going, vote them out.
T-Boz, TLC, you mean don't go chasing waterfalls? that TLC, wow, that brings me back. Well, that's great. And you also, somebody told me that you were also training people in this area. What's that training about? Advocates or people telling their stories or whatever?
Yes. If you are a healthcare activist and you have a personal story, you should go to healthcarevoices.org/learn, and you'll see all of our free trainings, which is about how to talk to reporters, how to write a letter to the editor, how to share your story in public, all of those things so that you can help change people's minds and hearts on this issue. Because I know that when Americans have the chance to vote for healthcare, they do. And we saw it in Kansas, where people voted to protect women's reproductive rights. And we've seen it in states like Nebraska and many others that have voted to expand healthcare. So when you get beyond the political labels and just get to whether you believe that every American should have healthcare, the majority of Americans are there regardless of their political party.
Yeah, that's absolutely true. So another thing I wanted to ask you in terms of healthcare voting is what states are really critical, right? We mentioned the four big states, or I guess it's 12 altogether, but the 4 million people who are doing without coverage right now. So obviously local races, there are critical, governors races, legislature races, and so on. But what about in terms of the House and Senate? Any particular beyond those states, any particular races you're looking at as critical on this issue?
Well, there are swing races all over the country, even in states like California and New York. There are several critical U.S. House races that, like the Staten Island race, or there's several in New York and several in California and other places. So even if you live in a state that is considered a blue state, there are patches where your vote really makes a difference. And so that's why it's important, even if you think that there's nothing at stake, that you have to go vote this November, do the research, figure out where they stand on the issues, and then vote accordingly. Because when you don't, We see things like West Virginia just passed an abortion ban. Senator Lindsey Graham is proposing a national abortion ban, and not a single Republican voted to lower drug costs through the Inflation Reduction Act. Not a single Republican voted to lower healthcare premiums through the Inflation Reduction Act. So you see things like that when they think people aren't paying attention.
Well, I just have to get this off my chest since you mentioned Lindsey Graham. Apropos of nothing, what a dumpster diver of a human being, which is disrespectful to people who are, who are food insecure. What a horrible human being he is. I'm sorry, I just had to get that off my chest. So what do you recommend that people do? Can they get more information on your website or some other website or?
Sure. Well, you can follow me on Twitter at @Packard, also on Facebook and Instagram at Laura Packard Activist. You can go to healthcarevoter.org and pay attention to what's happening in your state. For example, Michigan is going to have it on the ballot to vote on abortion. And other states may have ballot initiatives like that too. Arizona had one, but then the courts stripped it, which is, again, why it's important to vote all the way down your ballot, including on justices that you may not know much about, but take a little bit of time, do the homework, spend half an hour Googling people, because you would be shocked that even in places that you would think were pretty progressive, they have very retrogressive judges because nobody ever knows enough to vote on judges.
Right. And the other side is constantly looking for opportunity, where I feel as if, the progressive side sometimes is not, to be blunt. But so I think that's really important. But one last question before you go, and I think it was triggered by that phrase, do the research, which I get a response now because anti-vaxxers are always saying that. But I always get these letters. But the Biden administration has requested, and Senate Democrats, I know, and I'm sure House Democrats as well, have called for significant investing, some $18 to $22 billion in additional funding for handling COVID. And you have a sense, is that my sense from my own research, because I wrote a piece on it recently, is that the Republicans on this one too are clearly the obstructing force. I didn't find any other, it's not like other issues where maybe a Democratic senator like Manchin or some of Kristen Sinema is holding out. It didn't seem to me like that at all. It seemed as if clearly Republicans are the problem on that one too, and hundreds of people are dying every day. But am I wrong about that, or isn't that another healthcare voter issue?
That is another issue because we have not fully funded the COVID and, in general, pandemic preparedness that we need to do. That, the money has already run out for the free tests. The deadline for getting your free tests mailed to you, I believe, was a couple weeks back. That they've just run out of money for that. They had the money to buy the new boosters that include that are updated for COVID, but there's no money after that. So I feel like some Republicans are answering to the misinformation in the base and in the media like Fox News or whatever, that is spreading conspiracy theories and inaccurate information about the pandemic. So it's for them to answer to their base to be reelected, they have to pretend that COVID is not actually a thing or it's a government plot or whatever. But also, I think some of it is they don't want us to get through this pandemic because they think that it benefits Republicans if we still have thousands of people suffering and dying, that they would rather hamstring our country for political gain.
There's a time I never would have believed such a statement could be true, but unfortunately now it rings all too true. So, last question. Are you optimistic, worried, some combination of the above, or you don't think that way?
I think some of all of it. Optimistic because we've seen progressives get more engaged. The polling shows that people are paying more attention, both as the election gets closer and also as these terrible Supreme Court rulings keep coming down that restrict our rights and freedoms. So I think progressives are getting more engaged. But also there is so much at stake, and the gerrymandering in several states means that the playing field is not level. But regardless, we have to win because there's too much at stake. We have to win, and so optimistic, scared, pessimistic, all the above.
All right, fair enough. I think that summarizes it for a lot of us. So again, Laura Packard, Executive Director of Healthcare Voter. As always, thanks for your great work. And as always, thanks for coming on the program.
Thank you.
And we'll be right back after this. I'm Richard RJ Eskow, and this is The Zero Hour.